Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Mini-BESTest Evaluation Systems Test assesses dynamic balance and postural control in individuals. It evaluates multiple balance systems, including anticipatory postural adjustments, reactive postural control, sensory orientation, and dynamic gait. The test is utilized to identify deficits in balance mechanisms that may contribute to falls or mobility impairments. Its main purpose is to guide clinical decision-making by quantifying balance impairments in neurological conditions such as stroke, Parkinson's disease, and multiple sclerosis. The Mini-BESTest Evaluation Systems Test provides a standardized and reliable measure to monitor progress and evaluate the effectiveness of rehabilitation interventions targeting balance dysfunction. The Mini-BESTest Evaluation Systems Test is indicated primarily for adult patients with neurological conditions affecting balance, including stroke, Parkinson's disease, and multiple sclerosis. It is appropriate for individuals exhibiting balance impairments that increase fall risk. The test is most useful in clinical settings focused on balance assessment and rehabilitation. It provides objective data on specific balance control systems, such as anticipatory postural adjustments, reactive postural control, sensory orientation, and dynamic gait. This facilitates targeted intervention planning and outcome monitoring in outpatient and inpatient rehabilitation environments. The Mini-BESTest Evaluation Systems Test comprises 14 items that assess dynamic balance through 4 distinct balance control systems: anticipatory postural adjustments, reactive postural control, sensory orientation, and dynamic gait. The examiner instructs the patient on each task, which includes sitting to standing, rising onto toes, compensatory stepping forward, standing on an incline, and walking with head turns. Responses are scored on a 3-point ordinal scale ranging from 0 to 2 for each item, where 0 indicates severe impairment and 2 represents normal performance. The total score ranges from 0 to 28, with higher scores reflecting better balance function. To perform the test, the examiner provides clear, standardized instructions for each item and observes the patient's ability to complete the tasks without assistance or loss of balance. The total score should be compared against established normative data and clinical cutoffs, where scores below 22 suggest balance impairments associated with increased fall risk. Scores between 22 and 26 indicate mild deficits, whereas 27 to 28 correspond to normal balance status. Clinicians should interpret results in the context of patient age, diagnosis, and functional level to inform treatment planning and risk assessment. The sensitivity of the Mini-BESTest Evaluation Systems Test is reported to range from 0.8 to 0.95 in identifying individuals with balance impairments. Sensitivity refers to the test's ability to correctly identify patients who indeed have balance deficits. In clinical practice, a sensitivity of 0.9 means that 90% of patients with balance problems are accurately detected by the test. The specificity of the Mini-BESTest Evaluation Systems Test typically ranges between 0.75 and 0.9, indicating its capacity to correctly identify those without balance impairments. Specificity measures the proportion of true negatives, ensuring that healthy individuals are not misclassified as having balance issues. For example, a specificity of 0.85 implies that 85% of patients without balance disorders will be correctly recognized as normal by the test. These values demonstrate that the Mini-BESTest Evaluation Systems Test can effectively distinguish between affected and unaffected individuals in a reliable manner. The Mini-BESTest Evaluation Systems Test was developed as a concise version of the original Balance Evaluation Systems Test, which was introduced by Horak and colleagues in 2009 to provide a comprehensive assessment of balance control across multiple physiological systems. Since its inception, the Mini-BESTest has undergone rigorous validation studies demonstrating strong psychometric properties. Research conducted by Francignoni and colleagues in 2010 established its high test-retest reliability with intra-class correlation coefficients ranging from 0.85 to 0.95. Construct validity was confirmed through significant correlations with established balance measures such as the Berg Balance Scale and functional gait assessments. Further studies have supported its sensitivity to change in populations with neurological impairments, including stroke, Parkinson's disease, and multiple sclerosis, with reported effect sizes exceeding 0.8 in intervention trials. Cross-cultural adaptations have also preserved its validity across diverse patient groups, reinforcing the Mini-BESTest as a robust, evidence-based tool for clinical use in evaluating dynamic balance and fall risk.
Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.